Is Dr. Holt on the phone?
Yes, sir.
Good afternoon, Dr. Holt. Please give us an update, please, sir.
I sure will. It's really only been a month, just to recognize and remind just how fast COVID has become on us. It actually just was first emerged in mid-November of last year. By January, they were seeing an outbreak in China. We had our first known case in the United States January 21st, and the first known case of a U.S. non-traveler in February 26th. We had our first cases in Florida March 2nd to 2020 of this year. The virus is clearly, in my opinion, more contagious than initially thought. Coronavirus stands for the common cold, and so we know that that is commonly spread. About 25% of the people estimated who are infected feel well, no or minimal symptoms, but can spread. The way it's spread is these what they call respiratory droplets. That's when you sneeze, cough, or even talk, certainly sing. And we've always recommended cover your cough and your cough etiquette. This is why now the CDC has recommended universal masking. Everyone should wear a mask or advised to. And this is because of this concern that there are some people who are infected but feel well and they can spread. So everyone that I see wearing a mask is actually doing a public service to protect others, and I want to thank them. Indirectly, we can also get this virus by picking up one of these respiratory droplets on our hands and touch our face. Coronavirus, in my opinion, and studies show that it seems to be stickier or last longer than some of our previous viruses, so hand washing and wipes are critical. There are studies and evidence to suggest that there could be a aerosolized or airborne, but everything that has been shown is that while you can experimentally detect the RNA, it is really not spread airborne outside of a setting where, like the emergency room or an ICU, where someone may be being put on an ventilator. As far as the severity, while we know everyone can get sick and even the healthiest of us could die, it's the elderly and those with severe medical or underlying medical conditions that are at much greater risk, upwards of 10 to 20 times. Currently, our epidemiological curve in Hillsborough, we've got 645 cases. 10% of those are over 65, 10% in the 55 to 64. We've had 9 deaths. A trend that is really more hopeful and wishful, and certainly is not a forecast, I want to be clear, but the past 3 days we have seen cases that have averaged 30 a day compared to the 40 we saw at the end of last week. But again, this is all driven by testing, and time will tell. Initially, and additionally, COVID-19 is not a county specific, it's really regional. So my colleagues and I were watching a Tampa Bay curve, upwards of about 1,500 cases, and we're looking to see any trends or similar things across the Tampa Bay area. It really doesn't matter if we see Hillsborough County cases go down, but Pinellas is going up. Emphasize again, I still expect to see cases to increase, and whenever we do see a sustained drop, the risk is still going to remain, as we've seen throughout the country, other cities, whether it's New Orleans, Detroit, St. Louis, and others being affected. Currently, our testing locally has averaged about 600 a day. We did have a peak in the first few days of April. Our hospitals, Tampa General, St. Joe's Main, St. Joe's South, and Florida Hospital, all are in the top 10 as far as hospitals testing in the state. We have Brandon Regional, South Bay, Moffett, and Florida Hospital Carrollwood also doing testing. At our county testing sites, I want to make it clear, they're other than feeling sick, that's the only restriction. There is no age, there's no travel history or anything else. Anyone who feels sick will be tested. Currently, we have 12 of our cases that are managed or followed in our hotel under our observation. As of yesterday, there were 17 of the cases were hospitalized, 30 in the ICU, and 17 on the vents. Modeling, as I think everybody has probably seen in the reported in the press, shows some encouragement, perhaps a peak that's a little sooner and not so severe. I always think about this sort of like our hurricanes. The spaghetti models seem to be showing maybe a landfall a little sooner, a little less storm surge, but there's really still a lot of illness, and what is projected for the country or Florida isn't necessarily what we're going to face here. Our public health investigations continue to be focused on those that have the highest risk to spreading it into the most ill. Our congregations of nursing home, hospitals. We also include our persons with disabilities. Always remind social distance. You can't infect anybody if you're not physically near them. So continue to take personal responsibility. We're going to increasingly see masks being common, but handshakes and hugs not so. Eventually, these stringent rules will have to be relaxed, and in the short term, but we must continue behaviors that will protect us from this virus. So, if I may borrow some terms from Sheriff Chronister and Mayor Castor, we may let you out of jail, but you're still on probation. Hospital preparations for the surge of patients that could come needing care is continuing. Jean has worked well fantastically with the hospital leaders in a very unified and coordinated plan for our Hillsborough County and the Tampa Bay region. I really believe it's going to be a great plan, but my confidence is that no matter what the situation we face, and it will be unpredictable and uncertain, the unity that the hospital systems have shown in developing this plan really ensures that I think we will have the flexibility to respond to what comes. Certainly want to recognize Brent Barnheisel from HCA, Belinda Grant from Advent Health, Aaron Skiba from Tampa General, and Carrie Eisenbach from Baycare for all they've done. Dr. Mercer Levine at this group, College of Public Health at USF, and of course, Dr. John Kern, who is our chair of our Hillsborough County Healthcare Plan Advisory Board. Our care coordination management for our outpatients is begun. Florida Department of Health and USF are beginning a process to screen all positive patients using our students and supervision, under supervision of their faculty, and we'll begin linking up our patients with the doctors and the hospitals so we can assure that we assist in any of their non-medical care needs as an outpatient. And finally, I'll close that our long-term care facilities, we are continue to respond to any cases, and as I mentioned earlier, we were reaching out to support and surveillance of our group homes of the developmentally disabled. Chairman, I'll stop there.
Thank you, Dr. Holt. Mr. Brewer, was I the only one that lost Dr. Holt there for a little while? I was disconnected. Was I the only one? Hello?
I heard the whole thing.
I didn't. So, Mr. Brewer, I'm having a little problem. I got disconnected there for a while.
Chairman Miller, this is Terry McElroy. I just got a text from James, and he got disconnected momentarily, so he's connecting back up.
Yeah, I got disconnected momentarily also.
Yes.
Dr. Holt, let me ask you a question, and maybe it's for you or someone else. Maybe I don't know, Mr. Dudley. Do we have enough testing kits and enough PPEs across the board to do what we need to do in Hillsborough County?
I will defer to Mr. Dudley on the testing kits and the PPEs there. We are monitoring closely, or with them also the hospitals and nursing homes and others. It continues to be a shortage, but we're doing our best to meet every need. So I would never say
you're breaking up, Doctor.
I'm sorry. I was saying I don't think we have enough, but we're trying to meet every need.
You're breaking up. I can't understand what you're saying. Maybe it's my end here.
This is Tim Dudley. Can you hear me, sir?
Pardon me?
This is Tim Dudley. Can you hear me?
You're breaking up, Mr. Dudley, but go ahead.
Currently for the supportive collection site, we have PPE in to sustain our current numbers.
Mr. Dudley, Mr. Dudley, I can't understand a thing you're saying. I'm having a problem on my end, I believe.
Yeah, I can hear him.
Yeah, I can hear him too, Les.
I can't hear.
You might want to log off and log back on again.
Yeah,
I'm sorry, what are you saying?
I'll send you a text.
log off and then log back on.
All right, I'll try that. Hold on, folks. Hold on. Let me try that again. I'm gonna go out and come back.
Yeah.
Somehow I heard me.
Can you hear me now? Hello?
I can hear you.
Sir.
We can hear you.
Okay. All right. My question was, and maybe Mr. Dudley can answer this. I have a couple of legislators that have called me wanting to know if Hillsborough County has enough testing kits and PPEs to do what we need to do because they feel that we are not testing enough in Hillsborough County. I told them I'd have to ask that question of either Dr. Holt or Mr. Dudley. Do we have enough testing kits and PPEs?
This is Tim Dudley. Collection sites, we do have an ample amount of PPE on site, and we have well over 4,000 kits currently on hand. So that'll move us quite a bit through the next few weeks. And as Dr. Holt briefed earlier, it's not just the Raymond James site, but we have other healthcare professionals that are currently tested throughout the community. So we just continue to push that effort, sir. And for those collection sites, we do have PPE coming in to support.
So right now we're doing okay.
Yes, sir.
Commissioner Miller, are you there?
This is Kevin. It appears Commissioner Miller is having a technical difficulty on his side. There's a connection issue.
James or Terry, do you have his phone number to call him?
I recommend at this point he should just call in.
Right now you're doing okay. Hello? Hello?
Let me call him.
Commissioner Miller, are you there? You know.
This is Terry. I'm on now. Yes, I'd recommend he call in.
He's back.
Yeah, right now you're doing okay. Hello? I'm having no problems today. Can you all hear me now?
I can hear you.
Yes, we can hear you. James, Commissioner Miller has logged in twice. You may want to, that may be causing his connection issues,
Hello?
according to the screen.
Yeah, Mike.
They're suggesting that maybe, oops,
Well, hold on a minute. Can everyone hear me now?
I can.
Yes, sir.
Yes, we can.
You hear me right now, Mike. Let's see how that works, okay? Okay, all right. Okay. Maybe they don't want the chairman to work today, so I don't know. Can everyone hear me now?
Yes, sir.
Yes,
Sir.
Yes,
Yeah.
sir.
Oh,
Hear you.
oh. Okay, okay. Does anyone have any questions of Dr. Holt?
I have my
Any questions,
hand
Dr.
raised.
Holt?
This is Commissioner Merman. I did have my hand raised, I think. Yeah, it still
Okay,
is.
Commissioner Merman, go ahead.
I wanted to ask Tim the status of these rapid tests. I've just read an article this morning that said that Advent and Baycare are both administering either the 45, I don't know, it's a short term. One is a 15-minute and the other I think is 15 seconds or something like that. But what's the status? Are we also going to get those rapid tests, or where are we? I know we're in the queue with the one provider, but I thought that they were only distributing to hotspots. And that's Abbott Labs. So, I mean, would that help our testing sites if we had more rapid tests available?
So we have rapid tests that are not the PCR tests. These are for first responders. I'm sorry, this is Chief Jones, Hillsborough County Fire Rescue. We have the rapid tests that are for first responders, law enforcement, fire rescue, EMS, some of the healthcare as well, and the nursing homes and ALFs. These are not the typical type tests that we're using for the public collection sites. These just measure the antibody that shows whether you have been exposed recently or in the past. If you got a positive to the recent antibody, then you would have to get a follow-up test. Additionally, there's an Abbott Laboratory rapid test, which is a PCR test. We have ordered those, but we have not received any of those, and I am not sure about the healthcare industry.
Commissioner Oakland, you recognize.
thank you, Chair. I appreciate that. This question is actually for Dr. Holt. Assuming that the information is actually being reported to the state, Congresswoman Castor has urged the state to begin regularly publishing data to the Florida Department of Health's COVID-19 webpage that discloses racial and ethnic demographic backgrounds. So I see that on the state site, but it's for the entire state. Assuming that the county is reporting that information to the state, the county level data regarding demographics of confirmed COVID-19 tests will help us better understand and how to address the needs in our community. Persons under investigation, who's been tested. We can see a disparity in the zip codes of where there's some economic opportunity versus not so much. There's not a lot of cases in areas that would indicate that people with lower economic status might actually also, be vulnerable physically. So what resources do you need to gather to determine for the reasons for this disparity in testings? And can you provide us the demographics that we're seeing at the state level, at the local level, so that we as policymakers can move forward on how to best address those communities of vulnerability?
I believe that question is best be answered by Mr. Dudley. Am I correct?
This is actually Dr. Holt. I might be able to provide some portion of that. The data, there are some county reports that I believe I will be shared. If not, I will I shouldn't happily. I saw one today, so I see no reason why they are not distributed, and they may actually be coming out. But what I receive, I will certainly make available to the commission, the EPG. like I said, I got my first one today. It mirrors like what you see on the state aggregate, but it has the county, and it looks like they chose the top 6 or 7 counties that were impacted. If you get down below a certain number, the power of the data, you get lost when it can show things that aren't actually predictable statistically. But it basically shows the number of cases by gender, by race, talks about the daily testing numbers and positive, and then the emergency room visits. As far as the dates or the zip codes of the testing ordered, the ones that would be done through the drive-throughs, that data should be available when it's entered and registered. And so that's a locally acquired data that would be available for the by the providers, probably more accurate. I've not seen any data other than absolute number of tests that show by zip code or anything identifying the individual source of the test. Outside of, I'm sure Baycare would have their data, and Tampa General may have theirs, because it's all entered into a data system. I'm unfamiliar with the drive-throughs. I'll stop there.
Okay, thank you very much for your answer.
This is Tim Dudley. We also continue to work with the JIC, and we've been working to get the widest dissemination and carrying that message of the testing that we have available throughout our entire community. And we continue to encourage the folks. Dr. Holt mentioned earlier that we've taken a look at the different screening. We've adjusted the screening to a wide array of more of our citizens to get in for testing. And we absolutely encourage them to call 813-272-5900. And that's our triage line, so that we ensure that we're covering our entire.
Mr. Merrill, you're recognized. Mr. Merrill?
Going back to the rapid collection kits, when I had spoken with Abbott Labs, they said that really all of the manufacturers of the rapid tests now are prioritizing their delivery first to hospitals and healthcare institutions, and secondly to state emergency management offices. And so we, through our procurement department, are now plugged in so that when Abbott can start distributing directly to counties or cities, they will do that. But right now their production levels, they said, are only sufficient to really address the priorities of hospitals and state emergency management. So we will likely get some of those rapid tests through the state. She said that they were sending about 200,000 of those to the state of Florida, I believe. But again, it's depends on how much production manufacturing they can ramp up quickly.
Okay. Mayor Castor, you recognized. Mayor Castor?
Yeah, thank you. First of all, Dr. Holt, that's a great number, 600. I had no idea we were doing that many tests a day, so that's good news to hear. And I have a question either for Dr. Holt or Mr. Dudley. I don't know who would answer, who would have the best information. But how about those individuals that call in and can get the test and don't have transportation? Do we have a way of going to them for the test? Or are we bringing them to the test?
Oh, we got the music.
This is Tim Dudley. We're currently working with Gene Early, the Hillsborough County Healthcare Service Department Director. We've been reviewing and working on establishing a system with selection criteria that we could utilize to ensure only home tests were tested or after determining their eligibility for that demographic. Additionally, he's going to identify other professionals who could do an at-home visit similar to that being done by Hillsborough County Healthcare under the Hillsborough County Healthcare Plan. Those clients, including and ensuring that they will have an ordering physician and someone to ensure adequate follow-up once the test results are received. So we're close to coming to a solution for that, and we should be able to implement that rather quickly here in the near future.
Okay, thanks. And Mr. Dudley, do you have like, just, I know you wouldn't have the numbers, but anecdotally, like how many people call in that don't have, do you know, like just sort of an estimate, or there people, is that a significant number of people that call that don't have transportation, or have you even encountered that yet?
I currently don't have that data in front of me. That's something we would have to explore. And that's something we certainly work out with our call center to ensure once we implement this plan, we have the best coverage possible.
Okay, thank you.
Thank you.
Okay, we're going to move on to Mr. Dudley. Do you have any management report? Emergency management report update, Mr. Dudley?
Yes, sir. We continue to support the collection site operation. We stood down this afternoon where you'll see a different look out there. We're installing tents over the collection site area for anticipated inclement weather as we go into the season. We will reopen again on Friday, April 10th. As of 11:30 this morning, we have 359 appointments that were scheduled for Friday. The call center remains open Monday through Friday, 8 to 5. So we're going to keep that call center open, and we're going to continuously allow our citizens to schedule those reservations now that we've made some adjustments on how we're going to be screening. And again, I ask that they call at 813-272-5900. We currently are supporting our guests at the quarantine and isolation sites. We have 2 guests in the quarantine site and 12 guests in the isolation site. We've been working with Dr. Holt and the healthcare professional community in supporting the development of the alternative care site plan. I think we should be able to produce a solid plan for our community. And once that body of healthcare professionals have made a decision, the EOC is prepared to move forward and implement that plan and ensuring that we have the appropriate alternate care site ready to go in the event that we have to do so. We have 1,300 requests filed to the state for resource request mission. We continue to fill those missions to those with the most need. Also, I want to remind everyone that we continue to take donations. The community's been very generous. Our medical donation site, 250 West Shore Plaza, remains open 9 a.m. to 3 p.m. Monday through Friday. We're still looking for surgical gloves, surgical masks, N95 masks, gowns, face shields, goggles. And we continue to have a community effort in those who are making masks now. We will take those in as well as we are following the CDC guidance and recommendation for that as well. We continue to work with our partners to develop a plan for unaccompanied minors requiring quarantine and or isolation. So we should have a plan to ensure that we cover another demographic of our most vulnerable. And that concludes my update. Thank you.
Thank you, Mr. Dudley. Commissioner Merman, you recognize.
Thank you. This is probably for Dr. Holt again, but if we're doing 600 tests a day, what's the average turnaround? Like say all of last week's tests would not be, those numbers would not be in our cases yet because you haven't gotten the test results back. Is that correct? Dr. Holt?
He may have left the call.
No.
Is he on?
Hello? Hello?
Dr. Holt? Yeah, Dr. Holt, can you hear us?
I hear you. What?
Did you hear the
Yeah.
question?
Did you hear the?
Can you hear me now?
Yes.
Yes, sir.
Oh, yes, I did. As I've indicated, the how fast the results come back are totally driven by where they're collected. The general has the shortest turnaround in Baycare, and the others in the hospital, the ones that they draw there, those are 24 hours. The state is about 48 hours. The other commercial, which really is the one you're talking, or I think where that's the range has been huge. Right? I've seen ranges from our tests that have literally been like 3 days to 14 days. They report, the providers are telling me it's typically closer to 5 or 7 days. But it's all over the place. There's examples of people that are, in the 13-day, but I think traditionally or not more routinely, it's probably in that 5 to 7.
Okay, and then but I think the other part of the question was those numbers don't get into our number of cases until you get those tests back. That's correct. Is that correct?
That's correct. I see a report the state has. They'll say the numbers that were tested, the number that were positive, and the numbers pending. As far as us getting a notified of a positive test, it only comes when the laboratory has been run and the results are positive. And we are, as I've mentioned in the past, we have been seeing some significant delays in that, us receiving that positive reports when they have been done in the community sector, unfortunately.
Okay, thank you.
Commissioner Altman, you recognize.
Thank you. And that relates to Commissioner Merman's question. So the testing that's being done at Raymond James is being the test itself and the results are being reported by the state or by the commercial labs, Dr. Holt?
The Raymond James is, and I'll have to defer to Mr. Dove. I think they've used a couple of different vendors at times, or depending on where they have gotten their swabs from. I think there was some from an email that we were trying to track down that came from the Department of Emergency Management that went to somewhere out. But the others typically have gone to Quest, and I don't get the negative ones, but any positive ones would be reported to the state. And those are the ones that I'm speaking, at least from my experience with, as far as the time factor. So I don't know if I've answered your question, but the testing systems are supported and operated, I know, more from my county partners, plus the community hospitals that are doing the staffing. I'll stop there.
Mayor Ross, you recognize. I'm sorry. Go ahead, Mr. Dudley.
Yes, for the portion of the question where you refer to the state reporting, we get collection kits in different batches. Of course, we're just turning over every stone the state is to get us the equipment. So we've had some batches that are prepaid. The labs are prepaid by the state, and you have to ship those off to those labs. And once those results come back, they're reported in the state Merlin system. And DOH then has access to those positives that come back for those labs.
Mayor Ross, I see your hand.
Yes, thank you, Commissioner. I'll defer to later in the call. The answer may come out in close. Thank you.
Okay, all right, very good. Ms. Snyder, you recognize.
Thank you, Mr. Chair. I just was curious, and maybe I missed this number from Dr. Holt earlier. What is the number of cases identified for minors, and how are minors? How's the quarantine process different for children than it is for adults?
Yes, ma'am. You know, I will get you the exact number of the minors. I do not have that right in front of me here. I may, but let me answer the second question first, which is the quarantine or the isolation. The difference really isn't any difference. I think these are the situations that we work closely because obviously they will need a caretaker. And so that's the type of situation that we would work with to find a means by which the minor, could be cared or be not put alone in a hotel, if you could imagine. But as far as the restrictions about, staying separated from people, there is really no differences. And I just looked, I don't have that age, but I will have it for you by Monday at least. If not sooner, I can email it to you.
Okay, thank you very much.
Okay. Move on to the federal and state legislative update. Mr. Wagner.
Good afternoon, Mr. Chairman and members. This is Brandon Wagner, Chief Government Relations and Strategic Services Administrator for the county, with a very brief update. At the federal level, both houses of Congress have publicly expressed a desire to replenish funding for the Paycheck Protection Program. As I indicated on our last call, there was a lot of applications and a lot of money flowing out and a risk of exhausting that fund quickly. The administration has expressed a desire to infuse another $250 billion into. Just this morning, the U.S. Senate went into session. The majority offered a new bill with $250 billion. There was an alternate plan presented by the minority, which, in addition to the $250 billion for small businesses, would also add funds for hospitals and local governments. Both sides tried to pass their measure by unanimous consent, but were not able to, and so the session adjourned with no deal. We expect that this will certainly not be the final word on these issues, and that further negotiations and attempts to come to an agreement will be forthcoming in the next few days. This also points to, I think, on a going forward basis, these kind of bills and negotiations will not be as easy as the first three. And so we will need to be patient as we await further assistance. Next, the Treasury Department is expected to release their guidance on the $150 billion state, local, and tribal relief fund that was passed within the CARES Act by this Monday. Again, this funding is to address necessary expenditures related to COVID-19. However, Treasury is not expected to allow lost revenues by local governments to be an eligible use. With that in mind, a Dear Colleague letter is being circulated by Congressman Charlie Crist in Pinellas County and Gerald Connolly of Virginia, seeking support for future assistance that would allow that lost revenue to be replaced with future funding. Next, we also understand that individual assistance checks are starting to arrive as early as today to individuals whose account information is readily available to the IRS. Those requiring paper checks will come soon after. Those funds are beginning to flow. Shifting to the state, per your direction on Monday, a letter was transmitted to the governor requesting protection for small businesses from eviction and protection of renters from sudden rate increases during a declared emergency. A copy of that letter is in your meeting materials and will be expanded upon on agenda item 5C in a few minutes. Further to the issue of price gouging, the Florida Attorney General's office is heavily publicizing their gouging hotline. That number is 866-9-NO-SCAM. In addition, they have created a mobile app for your phones called No Scam, and it's been established to allow users to report allegations of price gouging or alleged price gouging in real time. We will continue to monitor state and federal activities and report to you on a going forward basis. And at this time, that concludes my report, and I'm happy to answer any questions that you might have.
Thank you, Mr. Wagner. I see no questions. Thank you very much for that update. We're now going to move into project updates. We'll start with social service update. Mr. Carl Hannes.
Good afternoon, Mr. Chair, honorable members of the EPG. Carl Harness, Chief Human Services Officer. I'm going to provide you with a brief report on the efforts of the Social Service Department up to this point. Due to the COVID-19 pandemic, newly unemployed residents are seeking crisis intervention services while they're pending the arrival of either unemployment compensation benefits or the federal stimulus funding, which has basically doubled the request of our department. In response to that increase in demand for crisis interventional services, Social Services Department has made a request for immediate additional funding to significantly increase capacity to assist us with the impacted households. That will include most likely expanding call center operations and our eligibility assistance. We've been working very directly with Administrator Merrill, Ms. Wise, and Mr. Fessler on funding options to assist with this initiative, and this is a new initiative that the department is taking on. Among our ongoing efforts, the department call center remains open at full capacity to receive incoming calls. We're doing this telephonically, eligibility interview appointments. Our eligibility appointments are continue to be being done virtually. We're utilizing relaxed guidelines, criteria for the interviewing process, and we're waiving applicant signatures on the grant forms. And based on the abbreviated eligibility process and the increase in assistant requests, additional appointments have been added daily to expand availability to the services, to access to the services. Again, let me remind the body that the frequency of assistant rules will not apply. So anybody that has been scheduled on or after April 1st, crisis eligibility appointments, the 1 year threshold exemption will be excluded. Households impacted by the crisis with the loss of wage will be included in the vulnerable population definition to prioritize their access to services. The department continues to maintain ongoing communications with our utility providers as it relates to discontinuing of suspensions of accounts for non-payment and making sure that we refer delinquent account holders immediately for assistance. And also, again, we will be monitoring communications with the utility companies as it relates to when they anticipate disconnection orders to be resumed. I think I had shared with the body during the last report that we are in partnership with the Affordable Housing Department. We're developing a new program to augment our existing program to activate quick response for residents in need due to loss of wage from COVID-19. We have identified amount of funding, which is a combination of federal and state funds that we can use to be reallocated to the mortgage and rent payment assistance, which also include utility bill assistance. I'd like to quickly take this opportunity to recognize Ms. Audrey Ziegler and her talented team for all their relentless work on these programs. And that concludes my report. Myself, along with Ms. Ziegler, are on the call to answer any questions that you might have.
Thank you, Mr. Harness, and thank you, Ms. Ziegler and her staff for all their hard work in making everything run as smooth as we possibly can. Mr. Overman, you're recognized.
Thank you, Chair. Thank you, Mr. Harness. You've done an excellent job, and I recognize that the staff is working very hard to help our citizens. We have a lot of folks, and our nonprofits are feeling the strain too. They're taking a lot more calls, such as the Crisis Center and Metropolitan Ministries. And I think it would be helpful for us to understand what the greatest needs are in the community. For example, it would be beneficial if we could receive maybe a weekly report on the number of calls received to know how many more calls you're taking in the benefits requested, the percentage that qualify for support, and whether or not they're transportation challenged. That could give us some good intel on whether or not, for example, families have been able to access the grab-and-go food resource, whether or not they have masks to be able to keep themselves safe. There's lots of information that I'm sure is gathered in those calls that would help us in identifying areas of concern that we can address going forward. Is it possible that you have someone that can provide us with a weekly report?
Yes, Commissioner, we can provide you with some more detailed information. I can tell you, and I'll allow Audrey to jump in after I get done, that currently the department averages about 4,000 appointments per month. That's a kind of an average of 200 appointments per day at 20 days per month. We're anticipating in the month of April that increase probably going up to 6,000 to 8,000 or maybe even more appointments during the month of April. I can tell you as it relates to food being distributed, and we can get you more detailed information as it related directly to your question, but some of the numbers, and we're still gathering these numbers, but in terms of food resources that are going out to the public, in our call this morning, basically feeding Tampa Bay meals to date. And when I'm talking meals to date, I'm talking meals that have been delivered since the EOC stand-up that began on March 20th. So far, Feeding Tampa Bay has delivered 976,000 meals in our community. Likewise, the school board, from what I understand, since startup, has delivered about 1.674 million meals throughout the school district in the county, and we're still collecting information from some of our other partners. But just to give you an idea, there are a lot of resources going out to people in our community. And I don't know if Audrey has anything that she might want to add to that information.
Good afternoon. This is Audrey Ziegler. The only thing I'd like to offer Commissioner Overman is that we can absolutely provide additional information. Our call volume has doubled, as Mr. Harness mentioned, and we can be sure to provide this board more information as to what the critical need areas are, especially if there are needs that we are not able to address at this time, and work on potential pilot projects where we can quickly get information and resources to people if we identify those additional needs.
Thank you.
Okay. Thank you. I see no other questions, Mr. Harness. Mr. Harness, Ms. Ziegler, thank you very much. All that you're doing, we appreciate it very, very much. Now we'll move to the update on Spectrum and school internet connection. Mr. Ramin.
Chairman Miller, this is Mike. Ramin may not be on the line. He had actually a personal matter to take care of, but his letter is attached, or his memo is attached. He's made contact with Spectrum. This is the second contact we've made. There was an earlier contact requested by a not-for-profit organization. I can't remember the name of. But as your memo indicates, or his memo indicates, Spectrum is now and will continue to work with the school district, providing providing Wi-Fi hotspots and also addressing areas where there currently is no service. So they're on board. We'll continue to work with them. I know they're working with the school district as well, but I think his memo basically, can give you the information you need.
Okay, Mr. Merrill, thank you very much. Appreciate that. Chief Judge Figueroa and Sheriff Cronister, an update on regarding enforcement of commercial evictions.
Yes, sir, Mr. Chair. This is Chief Judge Ron Figueroa. Glad to be on the call with all of you. I was reached out to regarding this issue. Our civil judges had a conference call on Tuesday. We reviewed the governor's executive order, and of course, like most people, were a little confused by some of it. It's clear that the governor suspended and told any statute providing for mortgage foreclosure cases. So the judges here in Hillsborough County will not be hearing any mortgage foreclosure matters, either commercial or residential, at least until this order expires on May the 18th. The conundrum came with the second paragraph regarding limiting the evictions causes of action to only those for residential tenants, and did not include the commercial tenants. And I had a conversation. We had a conference call yesterday with Christine Beck and Sheriff Chronister, and my administrative order, which authorized the sheriff to not issue writs of possession, which would be these eviction notices, is still in effect. It'll be in effect until April the 19th. I am issuing an amended administrative order that will probably come out on Tuesday that will extend that authority, and I'm going to leave it a little bit more open-ended until further order of the chief judge. So that's where we stand on that. I believe Sheriff Chronister researched the actual number of pending commercial evictions, and so I'll turn it over to the sheriff.
Sheriff Chronister, you recognize.
Thank you, Mr. Chair, Mr. Chief Judge, appreciate it. Yeah, I think that's the good news. After our last conversation, went back and researched the number of evictions that we have. We have 181 evictions on hold right now. Only one of them is commercial related. So I just wanted to be able to show this group that the impact so far hasn't been on any commercial and small business. And I know that was the intent of this group, was to make sure that our small businesses weren't being hurt even more as they aren't able to be open. They return to business and find their belongings or the contents of their business sitting on the curb somewhere. That certainly isn't the intent. After speaking with our county attorney and the chief judge, our intent certainly would be to make sure this moratorium here, as long as with the group's approval, of course, would be to continue a moratorium on all evictions, and that would be commercial related as well. Again, knowing that it only included one out of 181 evictions that we're currently holding.
Okay. Thank you both. I don't see any questions at this point in time. So thank you very much for that information. Thank you very much. Excuse me for all of your hard work.
Mr. Chair, may I be excused? Mr. Chair, may I be excused from the call?
Who is this?
Judge Figueroa. This is Judge
I'm going to tell
Figueroa.
a chief judge is asking me to be excused from a call? Yes, sir. Okay.
I've got to get back to doing some judge work, okay? I want to thank you for your leadership, and I want to thank all the members of this group. You all are doing a great job, and on behalf of the judiciary, we appreciate it. Thank you.
Thank you, Chief Judge. We appreciate it very much. Thank you. We'll now move to the letter to the governor for action. Mr. Wagner, you want to expound on that some more?
Mr. Chairman, this is Brandon Wagner again. As I indicated before, in the materials is the copy of that letter. We believe it encompasses the spirit of the request. It has been transmitted to the governor, copied to you, and we are awaiting his response. And I can answer any questions that you might have.
Any questions, Mr. Wagner? I don't see any hands up. Mr. Wagner, thank you very much. Hold up. Jeff Krause, do you have a hand up?
Yes, sir. I just wanted to add, one of the things we did explore yesterday during our conference call was to make sure with the emergency order being issued by the governor that his order supersedes any local group's order. We didn't feel that we were being any type of violation because he doesn't mention commercial eviction. So I think the letter's a great way to start. So it would positively impact and be able to help the residents for the entire state of Florida. But just so to provide an update to the group, we didn't feel, with the guidance of the county attorney, that we were superseding any governor's order because it's simply not mentioned.
Okay. Thank you, Sheriff. Appreciate that. See no more. Commissioner Overman, you recognize.
I know, I'm sorry. I just had one question, and since both parties have to answer it, or at least can provide some guidance, that would be great. We mentioned last week that we wanted to send out information regarding social distancing and the governor's order as it pertains to religious organizations. Sheriff Chronister, can you help us with some guidance on what law enforcement's role will be when there's more than 10 people in an institution, there may not be masks present, and people are actually congregating for Easter Sunday?
unfortunately, point, our role would be to enforce whatever the order would be. The order deems them as essential. So our intent is to continue focus on education. We're going to place out numerous street signs encouraging congregations to not gather more than 10, to do so safely, to wear a mask when they're afforded that opportunity. But again, unfortunately, under the governor's new order that supersedes any local orders, we're going to be left with only being able to focus on educating our community. Now, I do believe from speaking to a lot of pastors throughout the community, most of them are doing so. Most of them are focusing either online services. There are some that are even doing drive-in services where they will go into the church's parking lot, stay in their cars, and able to broadcast over radio, which I think is a phenomenal compromise. Again, even to the one church that we had problems with and unfortunately had to effect an arrest, we sent a letter pleading with them to please use common sense and CDC practices if they choose to have services. So again, we made another plea with that church, trying again to keep not just that congregation safe, but as that congregation returns back into our community, our entire community as a whole, to try to keep them safe.
Thank you, Sheriff. Appreciate that. I see no other questions. Thank you very much. We now move to the update on scooter businesses. Ms. Beck?
Yes, Mr. Chair. This is Christine Beck, the County Attorney. Good afternoon, EPG board members. At the meeting on Monday, a question arose about scooters and whether they are allowed under the governor's order. Our research has found that the scooters are not being used in Hillsborough County, Temple Terrace, or Plant City. They are only used and allowed in the city of Tampa. So we have been in contact with the city attorney's office and the city of Tampa for purposes of advising their police department and complying with the governor's order, believes that the scooter employees are covered as an essential critical infrastructure workers under the CISA Homeland Security 2.0 document under the transportation and logistics section of that document. We have also been advised that only 2 of the 4 scooter companies are still operating, and that of the 2 remaining, they have significantly reduced the number of scooters available. We'll stop there and be available for questions.
Okay, I see Ms. Snyder, you recognized.
Thank you, Chair Miller. I think the conversation was not so much whether that's an essential business as much as we were concerned about, the sanitation and making sure that the scooters were being regularly cleaned so as not to spread the virus to the users of those mobility devices. And so I don't know if that's a concern for any of the members of this group, if you want to open it up for conversation, or if you've got information to share that would show that the scooter companies and the bicycle companies are doing their due diligence. But I think that was more the concern than whether or not it was essential. We know, at least I interpreted it as that is an essential business for transportation purposes, so that people have some mobility to get from point A to point B that need to, especially people who are essential workers, having the ability to use that for transportation. I don't think anyone argues that point, but just the concern for sanitation, that was I think the main concern brought up at the meeting on Monday.
Okay. Any comments, any other questions on that issue? Mayor Castor, you recognize?
As I said in our meeting on Monday, those scooters, there's only, as was stated, there's only 2 companies that are still running, and their average trips are 1.3 miles. So they are used for transportation as well. And they clean them 3 times a day. So that's the sanitation portion of it. And the bikes, I don't think anybody's using the bikes, or not many people.
Ms. Snively, do you have something else you want to say?
I'll just say that, I'm glad to hear that they're being cleaned on a regular basis. I think there's a point where you have to leave some of that to personal responsibility, because you could probably say the same thing about, gas pumps and shopping carts and things that get touched on a regular basis. And obviously we can't stop everyone from touching everything. However, hopefully people are taking some responsibility to protect themselves as they're using these mobility devices and everything else that gets touched with, sanitary cleanser or wipes or gloves or something to protect themselves. So if everyone is satisfied that that's not an issue, then I think we can move on. But thank you.
Thank you, ma'am. Thank you. Okay, we're going to move to Mr. Paul Johnson, extension of the Hillsborough County Emergency Order. Mr. Johnson.
Good afternoon, group members. Paul Johnson, the County Attorney's Office. I believe each of you have received a copy of the fourth extension order. It's basically a updated version of the last three. It will allow us to continue our efforts through April 16th. I'd be glad to answer any questions you may have.
I'll move to approve.
Who is that?
Commissioner Merman.
We have a motion by Commissioner Merman. Is there a second?
Second, this is Andy Ross.
A second by Mayor Ross. Any discussion on the motion? Any discussion on the motion? Seeing none, roll call, please.
Miller?
Try that again. We're having a problem. Say that one more time. Everyone getting the feedback I'm getting?
Yes.
Pardon?
Maybe someone else can take roll call.
I can do it. This is Brett.
Who was that? I'm getting feedback. Is that just me?
No feedback now.
Chairman Miller, this is James. Michael Streeter is our clerk on the call, and he is experiencing some feedback issues every time I unmute his microphone.
Can you guys
Yes.
hear me? With the clerk, I can do it.
This is the clerk, Mike Streeter. Can you guys hear me?
Yes.
Yeah, go ahead now.
Good.
All right, good. All right, sorry about that. All right, Miller,
Yes.
Merman,
Yes.
Overman,
Yes.
Yes.
Cronister,
Yes.
Castor,
Yes.
Lott,
Yes.
Snively.
Yes.
All right, motion carried 8-0.
Okay.
This is
Now-
Andy Ross. I didn't vote, but I would vote yes too.
You missed
I'm
Mayor
sorry,
Ross.
Mayor Ross?
Yes.
Okay.
Okay, I apologize for that. Then motion carried 8-0.
Okay, we're now moving to EPG discussion. Ms. Snively, I see your hand still up. Is there anything you want to discuss?
Yes, Chairman Miller, I just wanted to give the group a little bit of information since it was brought up in conversation about grab-and-go meals and about accessibility and what the district is doing. As you heard, we have served over 1 million meals to our students and families. And we are actually, in addition to the 147 sites that we have grab-and-go services, we are also taking meals into neighborhoods in case there are transportation issues for some of the families who don't have the ability to drive to a site on a regular basis, to make sure that we're feeding our families. We also have, we are trying to move from daily meal preparation to weekly meals. So now people can pick up an entire week's worth of meal instead of having to come to a site every single day. They can take an entire week's worth of food to help with those issues of transportation and accessibility. 63% of our students, which is about 123,000 children, qualify for free and reduced meals. And their family members, their siblings are also eligible for those meals as well. And then for connectivity, we also want to make sure that everyone knows that the superintendent has purchased 500 hotspots to go into some of the neighborhoods that don't have accessibility to connectivity, even through Spectrum or Comcast. And so we're doing our best and our due diligence to try and make sure that we're getting out to the families who need that connectivity, that the devices, checking them out. Almost, we're going to probably end up checking out about 75,000 devices by the time this e-learning is in full process. And just wanted to kind of give everybody an update on what we're doing to try and create some equity with our student population and making sure that we're getting to as many families as possible. So thanks for the opportunity just to give you that information.
I'm sorry. Thank you very much for that information. Thank you all for what you're doing. We appreciate it very, very much. Thank you. Commissioner Overman, you recognize.
Thank you, Chair. As it actually relates to what Ms. Snively brought up, we now know that CDC recommends masks, and not everybody has one. And we also know that there's a great need for SNAP benefits and WIC benefits. Those packages that go out to families, is it possible if our collection center over at West Shore or wherever are collecting masks that can be passed out to individual families, that can go with the food? So we're making one trip, make sure if they need a mask, that they are asked if they need one. If they need access to internet, that information be captured. Or if they have difficulty with transportation to be able to get testing done. Is there any way we could utilize that manpower and gather a little more information to make sure we're not missing folks out there? Thank you.
Thank you. Who wants to answer that question?
Chair, may I ask for clarification on that question?
Yes, ma'am. Go ahead.
All right, Commissioner Overman, do you mean collecting that information at the site at West Shore, or collecting that information as we are encountering our families throughout the district through the grab and go process? That process, okay. So yes, because we are doing our best to collect as much information as we can in the safest way possible. We're having challenges as a school district with the PPE demand that's out there, because we want to make sure that the employees who are passing out the grab and go meals and the electronic devices are being protected as employees. But I will definitely speak with the superintendent and see what other information is being collected from those experiences, and if there's anything that we can cooperate or collaborate with the county on, and making sure that if there are families out there that need something else, that we can get that information to you. Thank you.
That's excellent. That's, Mr. Dudley had made a mention that we were starting to see donations of individuals making masks that aren't surgical masks, but are masks enough for families. And how that gets distributed out to families is more relates to that question. And since the school district is actually reaching out to so many people, I thought maybe that might be a nice marriage of efforts. So thank you very much for your report. I appreciate it.
My pleasure. And yes, that would make the most sense to be the most efficient way of connecting with families and getting their needs taken care of. Thank you.
Okay. Is there anything else we need to discuss today? Anything else we need to discuss today? I see no hands. Our next meeting is Monday, which is the 13th, if I'm not mistaken, at 1:30. Next Monday, the 13th of April at 1:30. I'm quite sure that an email will be coming out concerning any particular items you would like placed on the agenda. If you have any items you want to place on the agenda, please respond back to that email. If there's no further business for us to be discussed today, we'll adjourn. Everyone have a great weekend.
Thank you.
Thank you very much.
Thank you. Happy Easter.
Economically disadvantaged communities more than others.
See, you're a little tired. It's behind my eyeballs. Like, this is good. One thing I miss about Miami, the USC, a little cafecito. We never did get you a machine, did we? Get a little cafecitos around. You always talk about that every time we activate. You never have a machine. Not for me to start cooking that shit up, man. Like, you're the guy. Gotta get some Cubans and do it. Let's ask her. Shit. I'll ask. If I get you a company, like the company. Right.
Hey, Director Dudley, you guys are on the line.
You can hear me?